you may want to consider reversing the procedure and then referring to ENT. So take-homes from this case. First of all, it's really important to think about the different risks in different parts of the nose. Sometimes we feel most dangerous injecting superiorly because we all worry so much about blindness, but remember the lower third is a risk for those internal injuries. The second take-home for me is to make sure that when a patient complains of pain, especially if it's significant pain, that you make sure that you see them face to face, particularly if you've treated their nose, because I don't think there's anything you can do from afar to rule out an injury internally. You must see them and have a look. Thirdly, you may want to consider reversing the procedure and then referring to ENT, because I know that in hospitals in the UK they don't always feel comfortable using hyaluronidase to reverse our aesthetic procedures, so you could do your aesthetic element of complication management and then the ENT surgeons can deal with a hematoma or other injuries that might be occurring to the septum in the way that they normally do for septal injuries. And fourth, when you are injecting, remember that going too deep, injecting into the septum, that's the risk really I think you're most likely to cause this problem with. So stay at the right depth. It's a dangerous area. Make sure you're well trained and think a lot about the anatomy, because then these things should naturally occur to you rather than just replicating the injections shown to you by a particular trainer on a particular day. Understand the anatomy, design your injection technique around the anatomy, and that should make everyone a lot safer.